Elizabeth Harris. I'm the founder of the Center for Cosmetic Surgery in San Antonio and in New Braunfels, Texas. Initially, I had intended to pursue a career in art. I was approached by my art professors who had found my interest in science to be a little bit interesting in regard to the rest of the art students, and they had suggested at that time that I become a plastic surgeon. It seemed to me a perfect way of combining both the science and my art backgrounds.
She has a knack, an eye for it. I can tell she has this love for art, and a person who can see the beauty in things in art has to be able to see that in a character, in a human being. And the first time I met her, I had ideas and things that I wanted to have done, and she would always say, I see that you would benefit from this, and she would make just suggestions, and that was it. But I took her suggestions, and I would do it over again and again and again. I've just never been happier in my life. I've never felt better inside and outside. I feel younger than I ever have in my life, and I'm so grateful that I've met her.
After many years of study, in which I went to Northwestern University Medical School, and then took an 8-year residency in both general surgery and plastic surgery at University of Virginia, I am board certified by the American Board of Plastic Surgeons. This is a very difficult certification to be able to obtain, and it takes an intensive surgical curriculum as well as the 2 examinations which require the passing in order to be certified. I am now in private practice and have been for 15 years in San Antonio, Texas.
When I came to Center for Cosmetic Surgery, they greeted me, very polite, very nice atmosphere. I couldn't speak more highly of the environment here or the people that work here. I was a size 46 when I came to see her, so I believe I was close to the 300 mark, and now I'm currently at 240, so I had an extended tummy tuck then. I started off as a size 66, 68. These are a size 59, and currently I'm a size 40.
In my practice, the patients that come to see me are usually patients that wish to look better, either through conservative approaches or through surgical approaches, and it's best to be able to be adept at all the different type of options so that a patient can be given the procedure that they would do best with.
Dr. Harris herself has made me feel very comfortable throughout the whole time, always asking me if I had any more questions, making sure that I understood everything that was going to be happening, the drawings that she did out for me, the information before, after, all the way from the beginning to the follow-up to even the 6 months follow-up. She was always there in case I had questions or concerns.
I use a lot of my artistic background in order to judge which procedure the patients would do best with. Patients age in different ways, and understanding the 3-dimensional portrait of a patient, and I love to have patients bring a photograph of what they look like when they were younger so that I can compare what their aging is like in order to try to give them as youthful of an appearance as they previously had.
I'm having an upper eye lift and a fat injection in my face.
And what is that going to do?
It's going to stretch my skin just a little bit, give it a more youthful look, fill in these hollow areas of my cheekbones, and also fill in some of the hollow areas around my eyes, and the crease in my forehead, and the bead marks will go away.
It's a wonderful way to just take a few years off of your life, you know, and make you feel younger and prettier and in that middle age, you know, when you're starting to wrinkle a little bit and sag a little bit, and, you know, your face is kind of sunken in. The fat transfer was awesome because it just plumped up my face and just took all those hollow parts of my face out. And of course the eye lift was wonderful. That just took years off my life. I mean, I think 10 years. Well, I know I'm going to be really glad that I did this because in 5 years that skin would have been even worse, and I think that my eyesight would have really been affected by it. So I'm just looking forward to looking 5 years younger 5 years from now.
The goal is not to make somebody look different. The goal is to not give them a mask-like face or an overstretched appearance. The goal is to give them something very natural.
Well, now the first one was just something that I really felt I needed to have done, and that was a breast augmentation. My breasts were way too large, and I was having a lot of neck aches and back and headaches and back pain, and a lot of skin problems. And that was the first thing. And she did that, and oh my God, I mean, you can't even tell I had it done. And even my other doctors, they'll say, well, how do you like it? Because they can't tell. She got rid of the bags under my eyes, and I went back to work within a few weeks. Nobody noticed anything. It was so natural. Nobody could tell, but they just said, what is it about you? You just look so, rested, and you look so youthful. But nobody could pinpoint it.
My philosophy is good plastic surgery should be very natural looking. It should not look fake. It should look like they looked at a younger age in a very natural. Maybe their neighbors, maybe their good friends might not know that they had a surgery procedure, but they look rested, refreshed, and they look happy. And that is the goal of the surgery.